Okay, so this is definitely the comment that I saw the most when I talked about my experience as a travel ICU nurse getting floated to med-surg for the first time. But most hospitals do have a policy in place that prevents an ICU nurse who gets floated to the floor to have more than 3 to 4 patients max. Which sounds really crazy, I know, but just imagine getting floated to the floor where you don't know who anyone is, where anything is. You have no access to meds for at least the first 3 hours. And then on top of your 2 patients that are doing very horribly, you have 3, 4, 5 other patients. That creates a very unsafe environment. And I also wouldn't expect a travel med-surg nurse to get floated to the ICU and know how to zero an art line or get a CVP or titrate 11 drips and pressors in order to keep the patient's blood pressure up, in order to keep the patient's literal heart beating, to keep the patient from dying. I would not expect you guys to know how to do that. At the end of the day, if you're a nurse, it doesn't matter what specialty it is. And yes, med-surg is a specialty because it takes a special type of person to do that. No matter what specialty you're in as a nurse, you're going to be working your ass off. You're going to be running your ass. You're going to be working hard. You're going to be working really hard for that money. So